want to make sure that we're making the best use of our resources to provide the best possible mental health care for people. We've worked with the local community over the past 2 years to get a clearer understanding of what people want for their mental health services and to help us shape a model of future delivery. We've done this in partnership with Harrogate and Rural District and Leeds Clinical Commissioning Groups. Primarily, people have told us that what they really want is to be supported to stay at home wherever that is possible. By investing in community services, we will reduce the number of inpatient admissions as well as the length of time individuals need to spend in hospital. Where people do need to be inpatients, we want them to receive care in safe, high-quality environments and have improved privacy and direct access to outdoor spaces to support their recovery and early discharge. Inpatient facilities will be in York, and Tuve are already building a new mental health hospital, and this hospital will be able to deliver those benefits. In the short film that we will share with you, the changes we propose to improve adult mental health services will become clear, and this will relate to the Harrogate area. It will demonstrate how similar approaches in other areas of our trust have already had an impact.
Hello, my name is Hadi Al-Sayah. I'm a consultant psychiatrist and Associate Clinical Director based at Harrogate District Hospital and employed by Tees Eskin Wear Valley's NHS Trust. In terms of our existing services, we have a mixed model. We have a 14-bedded inpatient adult unit, which is mixed sex, called Cedar Ward, based at Harrogate Hospital. And we also have 2 integrated community teams, one based in the Ripon sector and the other based in Harrogate, which serve populations of adults aged 18 to 65. Alongside those, we have more specialist teams, including the early intervention team for young adults with psychosis, and the assertive outreach team, and a variety of counselling and psychological services, including IAPT and primary care. In terms of the proposals for the new model, and as part of the transformation in the Harrogate area, there are plans for a variety of changes. These would include a transformation of community services, which would mean enhancing the working offer, which may include extended hours and extended days of normal working. There would be introduction of new supports, so in terms of increasing numbers of staff working within community mental health team, the use of peer support workers, and this would look to work alongside the provision of beds which will be in the new York Hospital for Harrogate patients, and hopefully allow for a smooth transition of care both in and out of hospital. There will be consultant psychologist provision within the crisis team, and this will allow greater leadership and delivery of psychological assessments and treatments within that service. So it's hoped that these changes will be able to allow more flexibility in accessing services, allowing, for example, evening or indeed weekend appointments for people that are in work or have other commitments, and that the right care will be delivered to the right people at the right time. There are obviously examples of local success in terms of communities who've gone through similar transformations, namely in the Hambleton and Richmondshire region, which, as a result of the closures of the wards based at Friarage Hospital, Northallerton, underwent a significant similar community transformation. This has led to a variety of changes, but notably the number of beds occupied has remained low, and the numbers of patients treated at home has increased significantly. It is obviously hoped in the future that this will result in fewer and shorter admissions to hospital, with increasingly patients having care delivered nearer their place of home. So it's hoped that with the further development of staff skills, that the appropriate care and therapies, which will be evidence-based, will be delivered to the right patients, and hopefully that will result in better patient outcomes. So there are already a number of examples of where work has been successful to date in Harrogate, and these include having a single point of access and a triage process, which has helped streamline patients who are referred into services, maybe via their GP, and make sure that they receive help from the right service at the right time. There have been closer working between the NHS Trust and partner organisations in the voluntary sector, which has then allowed, again, support for an overall package of care for a patient when they come and require help. Other examples of joint working have included those with the police. Many patients, for example, who are extremely distressed and may be subject to more severe mental disorders are sometimes picked up under police powers, and through joint working with the police, through better detection and diversion of patients who have these sorts of difficulties, it's hoped that patients' time and experience under mental health services will be more streamlined. A further example may include the co-location of the crisis teams. In the past, we didn't have a CAMS or a young person's crisis team. However, now we have a crisis team for the under 18s as well as for adults, and these are located in the same place at Harrogate District Hospital, which has allowed for joint working between the services.
We want to involve as many people as possible in finalising our plans and are keen to hear the views of the local community on our proposals. Here's how you can get involved and share your views.